بسم الله الرحمن الرحيم وبه نستعين. أنا الدكتور أنس عكور، أخصائي طب الطوارئ والحوادث والسموم السريري في كلية الطب جامعة العلوم والتكنولوجيا. موضوعنا اليوم راح يكون عليه Enviromental Emergencies. أم، راح ناخذ موضوعين من ال Enviromental Emergencies اللي هي ال Heat Emergencies وال Drowning. سوري. أول موضوع راح ناخذه هو ال Heat Related Illnesses. طبعا هذا الموضوع هو common in our region و common also in the world. خاصة في حالات الهيت ويفز، موجات الحم أو موجات فيها ارتفاع في درجات الحرارة. Heat related illnesses or heat emergency عبارة عن continuum of disorder بتتراوح من الهيت edema or heat cramps وبتنتهي بالهيت stroke with multi organ failure and death. طبعا بعض الستاتستكس هون عندنا انه during the summer of 2003 إن فرانس كان في heat wave وكان estimated حوالي إنه more than 14,000 of deaths during that period. The same thing in Russia. كان في heat wave in July August in 2010. And it was estimated that around 15,000 deaths during that period. طبعا غير الموربيديتي والمورتاليتي اللي هي associated with heat related problem مثل forest fire والsmoke injury. طبعا هذا بيوضح حجم الكارثة لما يكون في عندنا هيت ويف. بتكون أمور disastrous وبيكون في لود وبريشر على الهيلث سيستم. طبعا في كثير من الريسك فاكتورز اللي بتخلي البيرسون more prone to be affected or to have heat related illness. أهم واحدة اللي هو extreme of ages, those elderly person or elderly population or the younger population, children, young children, those are more prone to be affected by heat-related diseases. طبعا بالإضافة لذلك those persons who participate in external physical exercises خاصة الماراثون runners during military مثلا workout هذول more vulnerable to heat-related illnesses. Pathophysiology of heat-related illnesses. ما راح نفوت كثير في التفاصيل لكن generally speaking في عندنا hypothalamus in our bodies, and this hypothalamus is a structure can regulate our body temperatures. إذا كان في elevation body temperature, it can like send orders to different organ system to just decrease the body temperature. واحدة من الميكانيزم اللي الهايبوثالاموس بتعمل على decrease the body temperature is by increasing blood flow to skin and increase like sweating. فلما يكون في عندنا increase blood flow للسكن وفي عندنا cutaneous vasodilation وactive sweating كل هذا بيقلل البادي temperature. لكن اللي بصير في ال heat related illnesses انه بصير عندنا failure بالcompensatory mechanism. هذا اللي هو اللي بيؤدي للfluid loss والelectrolyte disturbances والcomplication related to heat emergencies. حكينا عن الهيت emergency إنه بتتراوح من الهيت إديما للكرامب للسينكوبي وممكن تعمل exhaustion وبتنتهي بستروك and heat stroke and multi organ failure. الهيت إديما بتكون عبارة عن transient swelling of the peripheries سواء كان الهاندز أو الليجز أو الفوت. الهيت كرامب بيكون painful involuntary muscle contraction. heat syncope بيكون في عندنا transit loss of consciousness بسبب vasodilation and severe volume depletion. الاكزوستشن بيكون عندنا nausea, vomiting, dizziness, و mild alternation بالlevel of consciousness. لكن it's not coma وما بتوصل لمرحلة السيجر ما بتوصل لمرحلة الستروك. وبالإضافة لذلك بيكون temperature is high but doesn't reach 40 degrees Celsius. heat stroke بيكون في marked elevation بالtemperature بتكون أكثر من 40 degrees Celsius. بيكون معها كمان إنه encephalopathy and multi organ failure. طبعا الهيت ستروك ممكن تكون exertional أو non exertional. الاكسيرشنال مثل ما حكينا إنه بتكون during heavy exercise or during military workout. non exertional heat stroke طبعا هي الكلاسيك هيت ستروك and عادة هاي بتصير بالelderly people والmore vulnerable people اللي عندهم medical complications or medical diseases. Again hit emergencies عندنا الهيت إديما حكينا عنها الأخطر منها شوي بتكون heat cramp then heat syncope and then heat exhaustion and lastly heat stroke which is a medical emergency. Okay, so the clinical assessment for heat related illnesses راح نبلش بالهيت إديما. مثل ما حكينا الهيت إديما بتكون في عندنا إديما بالهاند and feet. الإشي الكويس إنه it's transient and there is no need or no rule for diuretics in this case. Elite cramps, basically it's like painful involuntary muscle contraction. Again, it's transient and you need to treat patients supportively by just advise the patient to rest and apply some cooling measures and rehydrate the patient either orally or intravenously. Heat syncope, basically it's loss of consciousness due to peripheral vasodilation and large volume depletion. So it's important to keep heat syncope as a diagnosis of exclusion. So you need to exclude many diagnoses before reaching the heat syncope. So such as cardiac syncope or neurological syncope. It's important to remove such patient to a cooler environment, and you need to start rehydration therapy and apply some cooling measures. Heat exhaustion هي عبارة عن heat related illness. طبعا السبب بيكون excessive loss of water and electrolytes mainly sodium through sweating. طبعا هذا بيؤدي إلى intravascular volume depletion and inability to maintain adequate cardiovascular function during heat stress. ليش بيميز الهيت اكزوشن انه بيكون في rise بالcore body temperature لكنها بتكون below 40 degrees centigrade and you can notice also like profuse sweating and tachycardia and postural hypotension لكن المريض بيعاني من weakness, fatigue, dizziness, headache but there is no like no central nervous system complications such as stroke or encephalopathy, coma, seizure. Those are present in heat stroke. هيت ستروك هي عبارة عن life threatening heat related illness. ليش بيميزها إنه الكور body temperature بتكون equal or more than 40 degrees centigrade with central nervous system dysfunction. أم، طبعا المريض بيكون عنده altered mental status مثل confusion, agitation, delirium or seizure وبيكون المريض very dehydrated, hot skin, dry skin with multi-organ dysfunction in severe cases. This slide summarizes the main differences between heat cramps and heat stress, exhaustion, and heat stroke. Okay, so heat stroke is primarily a clinical diagnosis, not a diagnosis of exclusion. But we need to keep in our mind that there are many differential diagnoses for heat stroke we need to consider. Okay, so if you look here at the slide, sepsis, for example, can present with signs and symptoms similar to heat stroke. The same thing for meningitis, encephalitis, malaria, thyroid storm, diabetic ketoacidosis, sympathomimetic overdose, anticholinergic toxidrome. So just keep them in your mind if you encounter a patient with heat stroke. Heat stroke is characterized by complete thermoregulatory failure, resulting in hyperthermia and multi-organ dysfunction. Virtually every organ system can be affected. مثلا in the skin, usually patients have hot, dry skin due to anhidrosis. And musculoskeletal complication, this include rhabdomyolysis from heat-induced muscle breakdown. Renal involvement may manifest as oliguria and acute kidney injury. Cardiovascular effects include high cardiac output failure, dysrhythmia, and hypotension. Coagulation abnormalities can progress to DIC, leading to bleeding complication. Gastrointestinal and hepatic manifestations include vomiting, hepatic necrosis, and pancreatitis. Respiratory complications may include acute respiratory distress syndrome. Finally, neurological dysfunction is the hallmark of heat stroke and can range from confusion, hallucinations, ataxia, seizures, and lastly, coma. So, the key message here is that heat stroke is not simply elevated body temperature. It's a systemic disease characterized by thermoregulatory failure and widespread organ dysfunction, with the neurological impairment being central to the diagnosis. Heat stroke is associated with several characteristic lab abnormalities reflecting multi-organ injury. So patients commonly develop metabolic acidosis with elevated lactate due to tissue hypoperfusion. Electrolyte disturbances are common in such cases and may include both hyper and hyponatremia, as well as hyper or hypokalemia secondary to fluid and electrolyte losses. Renal impairment is reflected by elevated urea and creatinine, often due to dehydration, reduced renal perfusion, and rhabdomyolysis. Liver enzymes خاصة ال ALT وال AST may be elevated because of hepatic injury or necrosis, as we said before. Muscle breakdown or rhabdomyolysis causes a marked rise in creatinine kinase and may be associated with hyperkalemia and hypocalcemia. Finally, hematological abnormalities may include thrombocytopenia and coagulopathy, which can indicate DIC. Overall, these lab findings reflect the systemic nature of heat stroke and help identify complications and guide management. Management of heat stroke consists of two main components. عندنا أول إشي الرابid cooling والإشي الثاني هو supportive care. بالنسبة للcooling measures طبعا لازم تبلشها immediately. It should be initiated immediately. طبعا المريض should be moved to a cool or shaded environment. Well, most practical and commonly used method is evaporating cooling, طبعا which achieved by spraying the patient with tipped water while using a fan to enhance heat loss. في عندنا another or additional cooling strategies مثل إنه applying some ice packs to the groin and axilla ومرات كمان administered or administering cooled intravenous fluids. طبعا في عندنا another كمان strategies مثلا إنه cold water immersion, gastric lavage, peritoneal lavage, and even cardiopulmonary bypass have been described in the literatures, لكن they are less practical and rarely required in the field or in our department. أهم شيء إنه the goal is controlled cooling rather than rapid normalization of a temperature. The target core temperature is approximately 38.5 degrees centigrade. بالنسبة للسupportive care طبعا هذا يشمل على treating complication, monitoring of the patient. إذا كان في airway compromise we need to treat them. إذا كان في circulatory instability we need to address that and treat that. Also treat the electrolyte abnormalities, rhabdomyolysis, and address organ dysfunction and treat it. آخر إشي في المانجمنت ممكن نستخدم البنزودايازيبينز. طبعا هذا مهم جدا لأنه can reduce shivering and improve tolerance of cooling measures and treat seizures. So heat stroke management focuses on a prompt cooling to a target core temperature of 38.5 degrees centigrade combined with supportive care and treatment of complications. حكينا عن supportive care. حكينا إنه كل المرضى لازم they need to be monitored and assessed continuously and treat any complications. طبعا هذا ملخص للclinical management of hyperthermia. Okay, so let's move to another topic من environmental emergency اللي هو drowning. طبعا drowning هو عبارة عن respiratory impairment resulting from submersion or immersion in a liquid. نعرف إنه عفوا drowning هي عبارة عن process. It's not like a single event, and the outcomes range from a mild respiratory distress to cardiac arrest. مثل ما حكينا إنه drowning عبارة عن process مش single event. طبعا هاي البروسيس بصير فيها disturbance لل respiratory system وبتكون نتيجة ال submersion or ال immersion in a liquid. طبعا لازم نعرف شو الفرق بين ال immersion وال submersion. ال submersion عبارة عن إنه ال airway going below the level of the surface of the liquid، بينما ال immersion إنه ال liquid being splashed across a person's face. طبعا حكينا إنه عبارة عن إنه events بمر فيها الشخص وبنتهي إما whatever the severity of the respiratory distress أو إنه مثلا cardiovascular collapse and death. طبعا initially أول إشي بيكون في عندنا initial breath holding. طبعا هذا followed by involuntary laryngospasm and aspiration of fluid. بيؤدي إلى hypoxia and hypercapnia. وهذا بالنهاية بيؤدي إلى cardiac arrest if not reversed. طبعا the primary injury is hypoxic brain injury, not water volume in the lungs. فالفيتشر هنا إنه ال patient may present with coughing or dyspnea or hypoxia or altered mental status or cardiac arrest. The pulmonary finding can include bronchospasm, pulmonary edema, and acute respiratory distress syndrome. لنعرف إنه ممكن a small amount of fluid inactivate surfactant and impair gas exchange. ما في فرق جوهري بين التريتمنت والمانجمنت إذا كان البيرسون submerged in fresh water or salt water، لكن لازم نعرف إنه الفريش ووتر فيها microbial burden أعلى من السولت ووتر. طبعا هذه الكلينيكال consequences للدراونينج patient. الانيشال assessment for those patient لازم أشوف ال respiratory function، أتأكد إنه is functioning well, breathing is well and airway is intact. أتأكد من circulation is enough and adequate. ولازم أشوف إذا في end organ damage. إذا كان المريض صاحي وبيحكي لازم أتأكد من الsymptoms، إذا في عنده chest pain for example or عنده shortness of breath or عنده مثلا head injury أو عنده headache. ولازم أعمل examination أتأكد إنه المريض ما عنده أي injury ما عنده أي complication من الإيفنت اللي صار معه. Investigation of victims of drowning should include ABG. طبعا هذا مهم جدا حتى أعرف ال level of CO2 in his blood or her blood، وأعرف ال level of partial pressure of oxygen كمان. ال chest x-ray is very important حتى أشوف إذا في no signs of aspiration or في lung injury, pulmonary edema, ARDS. بالإضافة لذلك ال ECG and cardiac monitor. أيضا ال vitals مهمات جدا من ضمنها ال temperature، لأن هذول المرضى بيكونوا عرضة للهايبوثيرميا. بالإضافة لل kidney function, electrolytes and glucose level they are also very important. Consider blood cultures إذا كان في significant aspiration. إذا أنا شاك مثلا المريض في عنده head trauma, spine tenderness for example, so we need to consider imaging such as CT scan for those patients. Okay, so regarding the management, for those patients we need to follow ATLS principles. We need to protect the airway. We need also to immobilize the cervical spine and also assist the breathing and the circulation and etc. طبعا كل drowning patient should receive the highest concentration of oxygen except those patients with normal oxygen saturation level, normal auscultation, normal chest x-ray, breathing well, they don't need oxygen. طبعا إذا كان المريض asymptomatic in the department وما عنده أي evidence على chest x-ray and their ABG is fine and normal so they can be you can send them home. Otherwise, all symptomatic patients should be admitted for observation. مهم جدا نعرف الفيرست ايد measures. لما تتعامل مع حالة drowning. So أول شيء you have to put or place the drowning patient on their back on a flat surface. طبعا try to call the patient, and if they don't respond, check their breathing. At the same time, ask someone to call 911. If the patient is breathing, so just place him in the recovery position and warm him up with the clothes and blanket. If the person is not breathing, so you need to open his airway and clear his airway. So how to do that? Simply by either jaw thrust maneuver or head tilt chin lift maneuver. In case of a drowning patient, I prefer using jaw thrust maneuver as there is a possibility of cervical spine injury. After that, you need to check for pulse. So if there is no pulse, so you need to start artificial ventilation, so using mouth-to-mouth resuscitation. Okay, and just observe for chest rise. So you can do it up to 5 times, and then you start for chest compression for 30 compression. And then you just repeat the cycle, breathing and compression, until ambulance arrives. So if the patient starts breathing again before the ambulance arrives, they must be warmed up with clothes or blankets, and their wet clothes must be changed. Always monitor the patient and keep checking their pulse and breathing until the ambulance arrives. These are the key learning points. Please read them. Thank you.